Good morning. Good morning. I always laugh when they put pockets in women's clothing. It's always like this big. It's like, why bother with the pocket? So I promise you that though I am not known for introducing or creating my slides more than about 10 minutes before a presentation, I had no idea the level of addiction to running in this country. But I think this is a little bit reflective of what I've learned over the day and a half or 2 days that I've been with the LAM Action community and been here in the UK, is that we have so many similarities on either side of the pond related to LAM and the activities that are going on here. We are all, I think, looking at where have we been, and it's been an amazing first relatively similar timeline, 20 years of patient advocacy and research and advancements. And in the beginning, it had to be an all-out sprint, right? Because there was not much known about the disease, and we were losing our loved ones, and there was just no choice. But now we have good news, which I'll share with you, and we have to realize that we've got to shift into a longer run, if you will, or a marathon, because in my opinion, LAM is relentless and will keep running. And we have to keep up, and we have to give everything that we've got. So this is a marathon for all of us, and I think it's shifted to a global effort. So it is my sincere pleasure to be here. I did hear a very clear message that I need to stay on time, so I am going to talk quickly, and if you have questions or if I need to skip a few slides so that I don't get reviews for next year or something, I will keep moving. So what I'd like to do today is tell you a bit of an introduction and give some very brief highlights about the accomplishments that I think we've achieved globally. Provide some examples about how people get involved in the United States, really led by our patient community and some of the very innovative things that they're doing. And then maybe ponder some of the trends that are making us shift from this idea of a sprint to a marathon. First, I'd like to express my gratitude and happiness for being here. The entire team at LAM Action has been so gracious in welcoming me and making sure that I've slept well. And Leanne, Jill Hollis, Professor Ann Tattersfield is on honor, where is she, to meet a legend in the UK. And our scientific director, who is our legend, has sent his regards to Ann and the entire executive committee. I did get the opportunity to spend time at the LAM Center and meet the scientists there as well as the care team. You are extremely lucky. I can go on and on about healthcare in America, and you can probably go on and on about healthcare in the UK, but at the end of the day, you have an extraordinary resource in what you have at the LAM Center. So Professor Simon Johnson and Jan Johnson, the research team, Debbie, Suzanne, and Roya, wowed me with the sophistication of their science and tremendous synergy with everything that's going on in the United States. And then I did get the opportunity to meet Lucy and Sharon in the center. And I thank all of you. This effort and success that we've experienced is because of you in the room. Could I get a show of hands of the women with LAM in the room? Ah, fantastic. Pleasure to meet you. And a show of hands of the spouses, partners, family members who support you. And a round of applause for that group. Thank you. So very briefly about me, I do not have LAM, nor does anyone in my family. I am a healthcare executive. I am not a clinician or a scientist. I cannot take credit for all the things I'm going to talk about. I do my best to continue, but this is 23 years of a legacy started prior to me, and I'm happy to share anything that we've done in the United States with all of you in hopes that it continues our global success. A little bit more about me. I don't want to go on, but I am 5 years in the executive position at the LAM Foundation. As I mentioned, I ran nonprofits and worked in hospitals and healthcare systems and research prior to this. And if you were to ask my mother, she would tell you that really very little has changed in the 50 years since this picture has been taken. I still have the same haircut, I still love dresses, and I still like to boss everybody around. But sincerely, in all the positions that I've held over 27 years, this is the most meaningful and important work that I've ever had the privilege to do, and I have to thank my patient community in the United States as well as all of you globally for the opportunity to be a part of something that's much bigger than a job. So I don't know how much you all know. Again, the stories are so parallel. Our founder, Sue Burns, you have to be named Sue to have this job. And her husband, Francis Burns, started the foundation in 1995, just shortly after their daughter, Andrea, was diagnosed. And similarly, then Sue reached out to Francis. You have to be some version of Frank, Francis, Sue to be a part of the LAM Foundation. Frank McCormick is our scientific director and was the first person that Sue Burns reached out to for advice and help with her daughter, Andrea. And they then created the foundation, the three of them, and now you see us here in 2008. So very similarly, over dinner last night, it's hearing early in the 1990s, a group of clinicians started to see trends of patients with LAM, and they didn't know. There was no research, there was no clinical evidence, there was little hope about what to do with this disease, and they started to gather patients together. And I really think actually you were ahead of the United States at that time in having caring physicians who were saying we need to do something for this population of patients, and led to an extraordinary story of success. So I need to go through this fairly quickly, but I think everyone in this room can feel ownership for these successes because it's a global effort. But in the United States, we have about 2,200 women with LAM registered in our database. And I would say, you know, the UK is about 1/6 the population of the United States. And if you do the math, we're really quite similar. You may have a few other things to catch up, but it's really not that different. Over those years, we have raised $25 million from our patients and families, and we've sent about 14 million of that back out in terms of checks and activities to research. Talk a little bit more about that. I think collectively, we are very fortunate to have a treatment, right? We like to say in the United States that there are 7,000 rare diseases. 5% of those diseases have an approved treatment. So that is the top of, I mean, we're fortunate the way that it worked out, but not every rare disease organization, very few in fact, can claim that. We have a global network, including Nottingham, of clinics where when we get calls in the United States, there's 34 in the United States where we send people to find an expert for care, and then another 25 globally. And we have a passionate global network of scientists who are connected to LAM. We have hosted 22 versions of this meeting, the research conferences and Lamposiums. I'm going to talk a little bit more about that. The NIH is our National Institutes of Health. More on the research side of what you have with your National Health Service. And we've had a protocol. Has anyone been to the NIH in Washington, D.C.? A couple of hands. So go and spend 4 days and get poked and prodded and questioned and give all your blood and, right. I went as a control just to experience it. Wow, you guys go through a lot. But that is our database of information about this disease, which is over 600 patients have participated, and it's informing research all around the world. We have been recognized by the New England Journal of Medicine and the NIH as an advocacy organization to emulate. It was in the New England Journal related to the original trial where women participated in the MILES trial, leading to the approval of sirolimus. Again, exceptional for rare disease between the European Respiratory Society, the American Thoracic Society, and the Japanese Respiratory Society. We have treatment guidelines for how to tackle LAM. And then, again, no less importantly, there are 21 members now around the world of patient advocacy groups dedicated to organizing, funding research, giving support to each other related to LAM. So that is not an unimpressive list of what has been accomplished in really 20 short years. So our mission at the foundation, not surprisingly, to urgently seek safe and effective treatments for treating LAM. And we do that through really 3 things, same things you're doing. We fund research, we find doctors and clinicians who know how to treat this disease, and we get patients to them. And then we connect patients and families with each other because, as you know, this can be a lonely disease, and you're not going to meet someone every day who shares the journey that you've been on. So the three big things: good clinical care, funding science, and contacting patients. So our research and patient conferences, our version of what we're doing today, when I was in my interview to get this job, and the most terrifying thing of that interview is, please don't ask me to say lymphangioliomyomatosis because I'm certain I won't get it right. But the board kept talking about the secret sauce. I was like, I didn't see that in any of the reading that I did for the background of this interview. And the secret sauce is what they refer to as the magic that happens when you have caring scientists and doctors who get to interact with patients and families who are struggling with this disease. And that has happened at various versions of our conferences. What I mean by that is, in the beginning, in a church basement in Cincinnati, Ohio, 11 people and 2 doctors got together to talk about what it means to live with this disease. So it started with, not unlike today, educational sessions about the disease. And then it progressed to adding sessions for the scientists to be talking about research as it progressed. And then, well, it's like, well, if the scientists and the doctors are in this room and the patients and families are in that room, don't we need to have some opportunities where they get to interact? So we created roundtable discussions and what we affectionately call Doc Talk. And because every year you have to do something more, we created the Friday evening scientific awards banquet, where we started to bring, again, everyone together to celebrate a lot of what you know that you've heard that scientists are doing. And then, as you talked about this morning, you need money to do all of these things, so we host the Breath of Hope Gala. And all of this has been supported by the NIH, as I said earlier. We don't have any big funds coming into the foundation, but the National Heart, Lung, and Blood Institute, we apply every year for a grant, and they will fund this activity. So we did that for about 15 years in Cincinnati. Anyone in the room been to this event? A couple, see, the front row. Good, good. I like that. And in 2013, the NHLBI said, you're doing a great job, and you need to shake it up. You need to do more. It's like, of course, but you need to do it in another city. So Cincinnati's great, but we need for you to get out across the country. Not unlike what you're doing here in the UK, is you've got to get around because you have to get to more people and make it more accessible. So the first thing we did was we went to Chicago, and they were right. We doubled our attendance just by getting to another city with maybe a little bit more accessible airport, but it was a fabulous success. So we've tried to do new things, and one of the things that we've done is incorporated science and clinical care around other rare lung diseases. So the Rare Lung Diseases Conference and Lymposium, we actually did the first time in 2016, and we're doing it again in 2018. So it's all very similar, all of the same elements, but we realized that in talking about other rare lung diseases like Langerhans histiocytosis or Birt-Hogg-Dubé or pulmonary alveolar proteinosis, the scientists see these synergies between the diseases, and it takes a different direction. Very scary. Can you imagine me standing up in front of my patients and families and saying, thank you for giving us all that money for LAM, now we're going to go talk about something else? Not kind of the message you want to hear, but the truth is, bringing those patient organizations together and bringing the science together, we don't want to do it every year. We absolutely know our priority, but the NHLBI was extremely pleased with us, and it brought in new kinds of support. I'm not proposing that you try and do this because it is a lot of work, but I think it's something that globally we all benefit from and has shown to be effective. I want to spend a little bit of time on a very unique version of the conference that we did in November of 2017, and we called it the Patient Benefit Conference. An odd name, but the idea is we are making progress, right? People are responding well to sirolimus as a treatment, but life with LAM is still very challenging, right? There are so many issues, and so what we asked, we polled our patient community and our clinics, and we received 250 responses, and the questions were, tell us about living with LAM. Tell us about what could help you in the next 5 years. while we're on this journey to find better treatments and a cure. And some of the words that are in here are reflective of the answers that we received. So the question is, what are the 5 most challenging things about living with LAM? And the bigger the word, the more times that was cited. And surveying 250 people with 10 open-ended questions was maybe something I should have reevaluated, because we had 2,500 responses. And the last question was, is there anything else you'd like to share? Wow. But the challenges with oxygen in the United States are horrendous. Getting good equipment, that rose to the top. Living with shortness of breath. Being confident that doctors know what you're know that they're hearing what you're talking about. Uncertainty, the unknown, medications, the challenge of travel, fatigue. Anyone relate to that? Right? It's got to be something more than just the breathing piece of it. So we took this and we narrowed it down, because we could have had a 20-day conference on all the topics that were brought up. But this is what we grouped it into to lead what the focus of the meeting was. I can't say that anyone actually wrote, I want to know more about biomarkers and imaging. But what they did say, what you said was, we want markers. We want ways to understand, what kind of LAM do I have? Am I going to be the quickly progressing LAM that's going to, I'll get very sick very fast? Am I going to have the slower progressing LAM? Am I going to have multiple lung collapses? Because I see different things happening with different women. What could we learn through better imaging? What could we learn through new biomarkers that would help me plan my life? That's what that one means. The oxygen I mentioned, exercise. So many questions. Should I run more? Should I run less? Should I lift weights? What's good for my body? What's bad for my body? How much is enough? And then that became very much linked with the nature of fatigue. A lot of questions about coping, mental wellness, integrative medicine, therapies. So we addressed that. What can I be doing with meditation? What can I be doing with breathing techniques? What about yoga and some of these other treatments? And then the clinical experience. So in the United States, we don't have the luxury of a single place to go. Everyone is going to these 34 clinics across the United States, and understandably, they have very different experiences. And while we don't have any real control over it, we wanted to know, what would you like to experience? So I'm going to speed this up because we're going to get dinged. We flipped the whole presentation and we put the patients up at the front of the room. So these women all have LAM. They spoke on, there were 6 of them, they spoke on these topics and they expressed what they live with. We did then put a professional or a doctor on the spot and say, well, what do you think? This is what she's living with. What do you think that is, what's going on with her? And it was very powerful. We made them work constantly. So no banquet, no sitting down, no, just have a dinner and hear us talk. We put people to work at the Friday night mixer. So all of these boards, this says coping and mental wellness. Those were those 6 topics. And every room of this conference was filled with whiteboards and Post-it notes. And we wanted people to start working together. We did fill it with some fun. If you can believe, we found Noel Doty and the Zepparella, of all-female Led Zeppelin cover band. And Noelle has LAM. And that girl can sing. We didn't even know what we were getting into. We're out on this beautiful balcony, and all of a sudden they just, send it up, and it was unbelievable. I was like, who's taping this? Nobody. But we're hoping to bring her back at a future event. But you can't make this stuff up, right? So that was a good topper to the night. Then we sent everyone into workshops. Their charge was, with each of these topics, professionals, scientists, doctors, patients, families, they were to come up with proposals for what we might fund to make progress in these topics. And we used a methodology called design thinking, which is talking about empathizing with the problem from the patient's perspective. blue sky, the solutions, and then they had to narrow it down and make a presentation, and it was kind of like a game show. We went into this closing plenary, and each of the 6 workshops had to come up and bring up their big board and say, this is what we think are the next 1 to 3 things that we should do in this area. And then the ideas were recorded, and everyone voted. And the winner was the group with the oxygen, a new remote control device, so that you can change your oxygen flow without having to take your backpack off or having to go into a different room. But that was just one of at least 20 great ideas for these solutions. So we went into then our Breath of Hope Gala, where we celebrated with all the 100 women with LAM who were there. This is Sue Burns, who joined us as well, and we always honor the women with LAM who have passed away. We raise money, just like you do. Fund a Cure, auction. This is Zaria, who had a fabulous time on the dance floor, and I think was celebrating the fact that we were able to raise $200,000 that night just to fund the new ideas from this event. Remember I said earlier, doctors, scientists, patients, how does this whole thing work together? Zaria was so inspired by this event and interacting with these doctors and scientists and hearing about some of the new advancements. She finally got her paperwork together to consent that if she ever progressed to transplant or any other surgery, she would donate any of her tissue to research. Zaria received her new lungs 6 weeks ago at Stanford University in California. Her explanted lungs went to 6 of our labs where our scientists are working with fresh tissue because that's the best way to study LAM is the real cells. And the reports back that I've gotten is, in a quirky way that a PhD would say this, they were the most beautiful tissues I've ever seen. And so she knows that she's now advancing the understanding of LAM and science for you. So a lot to cheer about with Zaria. She's a very courageous and wonderful woman. So we now have 10 grant proposals in. The request is for about $275,000 worth of funding for these projects, and our scientific reviewers are looking at those now, and we hope to announce the new projects that have been funded from the patient request for support in these areas and improving quality of life for LAM by July. So patients driving the future of research and clinical care. We have our support group. Just like you, we call it the LAM Liaison Program, and I wanted to highlight this because these are all the 34 women who have LAM. This is a little bit dated, a few people have changed, who each have their own region, small parts of the country. I always feel badly out here. There's, really probably 8 people with LAM, and they have to like 1,000 miles to drive to go to a meeting. Yeah, Monique does a really nice job of at least keeping in touch with them. But these are all volunteers. What their charge is they have volunteer job descriptions. They sign an agreement every year. They agree to being that key support person from the foundation to anyone in their region who is newly diagnosed. They also agree that they will host events, reach out, stay in touch with us. They attend webinars and conferences. And then our way of recognizing them, because these are, just like you, extremely busy people. Children, families, jobs, LAM, right? It complicates everything. So we give them a stipend to come to the annual meeting. We will do some expense reimbursement for a luncheon or a support group. They'll often host meetings with our clinics, and we are now reaching 300 and 400 people a year through meetings like this all across the United States. And what's the impact? So we're now, the LAM Foundation with roughly 6 employees is now nearly 40, if you will, because we have all of these volunteers across the country who are easily accessible on a local level to give hope. I can send you these slides. Yeah. Yeah. All right. Information and resources. these women give their knowledge and experience of living with this disease. There's so many ways to give to a patient advocacy organization. There is writing a check, but there's also your knowledge and your experience and your sense of hope. And I appreciate that everyone is on a different piece of this journey, and someone will get a diagnosis and they don't want to hear from us. I understand that. But there is a point of time in which they do. And sometimes we think they don't want to hear from us, but they actually do, but they're afraid to call. And someone on a local level who's living with the disease can really make a big difference. More and more newly diagnosed patients are coming to the local meetings because it's very expensive to travel and go to these national meetings. It's an easy point of access. These ongoing connections and relationships are absolutely priceless to everything that we do. And don't underestimate what you can do to help another person with this disease. And I call this the new flavor of the secret sauce. It's like I have another bottle of the regional meetings. A couple very quick highlights of other interesting things that patients are doing. I want to make sure that I say hello to our global travelers, Sarah and Justin, who are in the room. Say hi, yeah, from New York. A couple of years ago, they embarked on a global adventure created a blog called Travel, Breathe, Repeat. As they were exploring the world with their passion of travel and their talent, they began meeting with women with LAM and clinicians all around the world, again, to build this global outreach of connection and hope. And if you haven't been to travelbreatherepeat.com, please visit it. Sarah has done a lovely blog for Worldwide LAM Awareness Month, and she's highlighted women with LAM around the world and what it's like to live with this disease. And I knew I was going to see you, Sarah, so I had to get you something kitschy. So I love New York and your bag because you have to keep traveling the world and talking to people about LAM.
Thank you.
Okay. Ooh, all right. Another patient, Charlene Dunn, one of our clinic directors, Dr. Dan Dilling, created with us, and so we're getting a grant, a support group specifically for people on the journey toward transplant. And it's two-sided. We actually applied for and received a grant from another rare disease organization to do this project, which is a combination of patient care and support and also educating people about the importance of tissue donation and why you need to consent, because if that tissue goes into formalin or if it goes into the garbage, it's not of use to our scientists. So the very good news is there are few needs for lung transplant anymore related to LAM because people are responding so well to sirolimus. The bad news is that's that kind of precious tissue that can be used in the labs. So of the 5 transplants in the United States related to LAM, only 5, all of them were harvested and distributed to our scientists through this program. So Charlene is meeting with women for education, creating a mentoring program and support group for families who are on this journey, and Dr. Dilling is leading the medical side of consenting and educating these patients to donate their tissue. This is making an extraordinary difference on the research side. For consideration, I mentioned a few trends, and I think it's more important than ever that we continue to have these patient-driven activities and initiatives through our advocacy groups, whether it's in China or Brazil or Canada or the EU, the UK. This activity here of you coming together and sharing your experience with LAM is the secret sauce, staying involved. In 1994, when you all were starting, there was no internet, social media, and I think it's completely changed things. All right, I'm getting the signal. But it's good and bad, right? There's so much familiarity with it. People think it's just another thing, but we have to stay vigilant about raising money and keeping connected. The impact of an effective treatment, as I mentioned, is fabulous, and we're not done, right? LAM is relentless. The treatment doesn't work for everyone. It's not pleasant to take. We want a cure. We are not finished. I just wanted to reiterate that in the United States, we don't have any big gifts either. 90% of every dollar raised about $1.5 million a year. It comes from patients and families. The rapid advancements in rare disease research require global collaboration. All of this privacy stuff is going to make this really interesting. But we know that in order to do real clinical trials and get enough people enrolled, we're going to have to be working with China, working with the EU, working with the UK. Cultivating new scientists and clinicians who are interested, finding new doctors, finding new Professor Johnsons. We need to be looking under rocks and finding more of them. And again, the gift of giving and the secret sauce is that we all need to share of ourselves and our talents. And like I said, it's a wide range of things that we can do to give back. It doesn't always have to be a check. It helps. But all of these other things are what keep the momentum going. And I'll conclude, my final slide, I promise, is a quote from one of my board members when I asked, what is our top measure of success? And this is what she said. It's to find the day when we are no longer talking about the disease, we're talking about the cure. And our job is to go find people who may be predisposed or who may have this, and they will be diagnosed quickly and accurately, receive proper treatment, and move forward with a long and productive life. So I thank all of you. Reach out to your LAM community, keep them inspired and engaged, and know that this moves forward with your commitment and your relentlessness to fight this disease. And I look forward to working with you in the future. Thank you.